Very good evening, friends. Meeting again in the session of Robert's philosophy, and we have started discussing about chapter number 23 from H.A.Robert. That is, this is classification, the Psora continued. And in this chapter, we have learned certain aspects of Psora. Robert has tried to explain the Psoric manifestations according to the anatomical schema as explained in the repertory. So in this chapter, he started with the vertigo, the typical functional vertigo, positional vertigo, which you used to get in specifically in this psoric manifestations. So slightest movement produces vertigo, vertigo while lying down, vertigo while rising up, vertigo by moving about. All those modalities are there, and patient is always felt better by lying down. This is very important feature related with vertigo. Same is true for the head. The headache, varieties of headaches are there, but headaches with a functional manifestations. There is no pathology, there is no tumor, there is no cyst, nothing is there. But the functional manifestations, the headache is so severe character, specifically it is in the frontal, parietal or temporal area. And there are multiple modalities. But common modality again is that patient feels better by lying down, complete rest. He feels better by heart fomentation. These are very important things. Then it is also good remedy for bilious headache. So acid peptic trouble causing the headache is psoric manifestation. Then he explains about the scalp and the hairs. The hairs falls out specifically after the any influenza or any communicable disease and hair starts falling down, that is typical of psoric manifestation. We have discussed one remedy, that is thallium, yesterday regarding it. Then how head looks like, it has typical normal counter and size. The hairs, they rarely perspire. Perspiration is absent. There is a dry, lusterless hair is the characteristic of over the. And second important thing which you can get over there, tangling of the hairs, which is quite common. Then there are eruptions which are again dry. Patient scratches a lot, it itches a lot. There is a lot of scaling which happens to be there. But there is no pustular formation or pus formation as we get in mesothelium in syphilitic miasm. And that is syphilis. When syphilis get attached with it, then such types of symptoms develop. Otherwise, you get only dead scales over there. The same is true with the eye complaints. There are many eye complaints which are functional in origin without any pathology. If there is a drooping of eyelid, he said it is syphilitic. So that is the manifestation of syphilitic miasm like causticum, where the ptosis is very marked, but Psora never produces a ptosis. Then second important thing which he has mentioned over there, that the red leads is characteristic of tubercular miasm. So he has compared Psora with the rest of the miasms at the same time. Then he has discussed about the ear complaints, and ear complaints here again you get the functional ear complaints over there. Sensitiveness to the noises are very marked with the psoric manifestation. All senses are always acute, whether it is sense of smell, whether it's sense of hearing, whether it is related with the eyes, the dazzling light, sunlight always aggravates. So sensitivity to all at all level is the manifestation of Psora. So same he has explained about the ears. There's very acuteness over the related with the noises is characteristic of it. Very occasionally you get the eruptions which are scaly, dry over there inside the ears. Then he has explained about the face. The face is typical inverted saucer shape, that is very characteristic inverted pyramid face. Then the perspiration which happens to be there specifically at night, but this is a pseudosyphilitic manifestation over there. The acne vulgaris, characteristic acne vulgaris or acne rosacea are psoric. The pustular acne are not at all psoric. Then he explained about nose, the same sensitiveness to the odors is very characteristic over there. Very occasionally you get the pimples over there on the nose. The lupus of the nose is characteristic of tubercular miasm. And I think on this note we have finished yesterday. So he's explaining it one by one. Now he turns towards the mouth. So today we're going to learn few more manifestations of the Psora. So we'll be there on page number 190. Let us start with the first paragraph. Sores about the mouth are psoric manifestations. Sores about mouth, these are the typical fever blisters. Herpes simplex or fever blisters are characteristic of the psoric, characteristically are psoric manifestation. There is swelling and burning about the lips rather than fissures. There is a thrush. It is oral thrush, oral fungal infection of the mouth, oral thrush. So there is a thrush and stomatitis in the mouth. The psoric patient has many taste perversions. This is again a functional. So they always talks. If the patient has a fever, they says everything looks like or it tastes bitter. Sometimes they say it tastes sour. There are many perversions which you can get over there. There is a bad taste in the mouth, or it may be sweet, bitter, or sour. There is a regurgitation of taste of food. These patients are very sensitive to taste. While all miasms or stigmata have many perversions of taste, Psora is the only one which manifests the symptoms of burnt taste. That is very, very characteristic. What is burnt taste? Burnt taste is a typical that you can immediately catch whenever you, if anything in the food item, it has been burnt and that typical taste happens to be there. And only the psoric person can catch that burnt taste. And that is very typical manifestation of the Psora. So patient easily explains. In Marathi, we used to say, काहीतरी करपलंय वाटतं आज जेवणात. That is typical sentence which they used to use. वरण करपलंय, वरण लागलंय. These are the things which they used to talk. This is very typical manifestation of it. Then he turns toward the general features, the desires and aversions, hunger. Sora is always hungry. This miasm has desires and longings for many things and various things. Sora, many desires, many aversions. Because functional, they are functional. They are hungry even with the stomach is full. They are never satisfied even while eating. They crave sweets, they crave acids, they crave sour things. In fevers, they crave the indigestible things. So this is one important manifestation of Sora. They like indigestible things like pencil, mud. They crave for it. They long for travel, yet they are weak and debilitated. They long for things the system is wanting. They long for certain things, but when they want it, when the want is gratified, they do not want them. During pregnancy, they long for peculiar things. Yet after gestation, they loathe the things they have craved. So there is one more important feature which you can get in psoric personalities. They craves for many things which they otherwise never craves. But during pregnancy, they craves many more things. That is abnormal taste which develops during pregnancy. Abnormal hunger and abnormal taste develops during pregnancy. It's a typical manifestation, physiological manifestation of pregnancy. In Marathi, we call it dohai lagne. That is a very typical feature. And that is psoric in origin. If it happens, it is psoric in origin. And whatever they want to eat during the pregnancy time, afterwards, after the pregnancy is over, they no more craves for that. Before bilious attacks, they crave sweets, but the attack is not caused by the sweet they consume. Rather, the craving is a forerunner to the attack, a prodromal symptom. So before getting a bilious attack, they start craving the sweets. It is not because of sweets they get the bilious attack, but it is only it is a prodromal symptoms with which they know that I will going to get the acid peptic trouble, acid peptic attack. That is they can explain because that is a prodromal symptom of the psoric miasm. Then he turns towards the stomach. There is a weak, gone feeling in stomach in the middle of forenoon. Hunger at night also is an important symptom. These patients lack the power of assimilation, which is undoubtedly the cause of the continual craving and is closely related to the characteristic gnawing of the stomach with sensation of heat and cold. There is a repugnance to the boiled foods. They crave fried, and highly seasoned foods, meats, greasy foods, but these do not suit. So there is a craving for many things. They are already too much hungry. Even they are eating, they feel they want more, much more. So greed is more marked with this miasm, and hunger for anything. They like tasty food more. So they like spicy, they like sweets, all tasty food. Even though it does not suit, it causes the trouble for them, but they crave it. Meat stimulates the psoric patient and arouse the underlying condition to the activity. In fevers, they have an aversion to sweets and craves the acids. So that is another characteristic. During the fever, they starts avoiding aversion to the sweets and they starts craving for the salty food or acidic food. The sense of fullness, gas, bloating, etc. are markedly psoric traits and they are accompanied by heartburn and water rash. Most of the aggravations of psora occur after eating. So see, this is very important feature which he explains over there. There is severe acid peptic trouble, naxomica, very typical manifestation. That there is they craves for spicy thing, they craves for oily food and all those things, and they starts getting the retrosternal burning. They wants to vomit. They vomits with their putting fingers inside mouth. That is very typical of the psoric manifestation. So these are the features with which you can understand psora is in background. So if you give Nux patient feels better, complement it with sulfur. Sulfur is complementary to the Nux and which covers the psoric background. So this is very important thing which he is explaining. Then he explains about the cravings and longings. What he says, the cravings and longings are basic phenomena of the great therapeutic value. A comparison of desires of stigmatic influence is not of much help in selecting the remedy. Psora desires hot foods, syphilis prefers cold food, psychosis wants food either hot or cold. So see, Psora desires hot food. Psora feels better by hot food. That's why Psora desires hot food. Syphilitic always desires cold food. And psychotic either hot, either cold. Psora desires meat, but the combination of psora and syphilis in the tubercular diathesis has an aversion to meat. So when psora gets mixed with the syphilis, the tubercular miasm, there is an aversion for meat. But psora alone always likes and craves the sweets, craves the meats. With the bloating of the psoric patient, he cannot endure slightest touch on abdomen. He fears even slight contact. That is another feature which you can get in China also. If you start examining, they never allow you to touch because it is so sensitive. Sensitivity is always increased with this miasm, and that's why the abdomen is so sensitive to touch that if you try to check, they immediately says no. That much sensitivity which you can get over there in Sora. While pure Sora does not produce any structural changes, Sora does produce functional changes. These are manifest in the chest condition by anemic manifestation that have their effect on duty of furnishing oxygen for the red blood cells. The emotional reaction of Sora hampers the natural functions to such an extent that the functions are disturbed and oxygen circulation feels the lack of vitalizing influence. So see, psoric, whenever psoric miasm is prominent, the emotional disturbances always produces some of the features. Even they get a typical hysterical breathlessness, manifestation of psoric miasm. They starts getting the what you can say it is called as the reflux esophagitis or globus hystericus, again a psoric manifestation. So these are certain things which you can get very commonly with this psoric because emotions and symptoms, there is a very close relationship in psoric miasm, and emotional trauma or emotional disturbance always produce functional symptoms and which are related with this specifically with the psora. The curve, now he turns toward the curve. The curves of the psora are dry, teasing, spasmodic and annoying. Annoying means they are irritating the person because of which person becomes irritated. It is so long standing and it continuously disturbs their mind. The expectoration of is usually mucus, scanty, tasteless. Salty and sweetish taste of the expectorations are dependable indications of the combined psoric and syphilitic traits. So when patient says the expectoration is salty and sweetish, urgent nitricum, very important remedy. Remedy is not purely psoric. Here it is combined with the syphilitic, so you can get the tubercular features over there, and you get salty and sweetish taste of the expectoration. So see, he has compared the Psora at the same time with the pseudosyphilitic miasm, and that's why we can understand both the miasms. So we get the Psora on one side, but at the same time we can get the tubercular manifestations also. Now he turns toward the heart, and this is very, very important. In the heart, there are functional disturbances with the violent rushes of blood to the chest and a sensation of weakness, goneness, or fullness about the heart. See, this is very important. There are functional disturbances of violent rushes of blood to the chest and sensation of weakness, goneness, fullness in the heart. Many manifestations, but all functional. Structurally, there is no change. If you do the ECG, it is normal. If you do the echocardiography, everything is normal. But patient has many symptoms. He explains, doctor, something is wrong with my chest. There is some problem with my heart. There are a number of features. The sensation as of band is psoric. Sensation of band around the chest. This miasm or stigma manifests itself. Just a minute, we'll wait for a minute. The sensation as of band is psoric. So band-like sensation around the chest, around the heart is typical of this miasm. This miasm or stigma manifests its reflex relationship of gastric and uterine irritations by marked palpitations and or sensations as if hammering about the heart. So palpitations because of some disturbance of abdomen, stomach, palpitation because of some uterine troubles, where the pathology never lies in the heart, it's typical of psoriasis. With the heart symptoms, there is always anxiety and fear on the part of the patient. So fear is more marked, anxiety is more marked. So patient comes and says, Doctor, I'm getting a palpitation, and there is some emotional cause behind that. This is purely psoric. There is nothing wrong with the patient. So you have to find it out remedy which is psoric, which is a typical psoric. The psoric patient always fears that he will going to die from heart trouble, but the psoric patient is a chronic who lives long and produces income for the physician. For he is the victim of so many unpleasant sensations that he requires much attention, and his habit of fixing his attention upon one or more organs as being the cause of his discomfort demands constant attention from the physician. He does have many uncomfortable sensations such as sharp cutting, neuralgic pains about the heart. These patient thinks they are about to die and wants to lie down and keep quiet, but there is no danger. It is the psychotic and syphilitic heart patient who die and then suddenly and without warning. The psoric heart condition are very much influenced by strong emotions, joy, grief, fear, and so on. So this is very typical with the psora. They have many symptoms related with the heart, but they never die. They live a long life because all the symptoms are functionally origin. There is no structural damage. Exactly opposite happens to be there with psychotic patient and syphilitic patient. There is no warning sign, and all of a sudden patient died, and it has been so fast that because the structural changes are already there, and because of which there are no warning signs which comes up, which psychotic and syphilitic miasm, the subjective symptoms are very less. There are objective structural changes are very much more. With psoric, it is exactly opposite. Structural changes are not at all there, or if they are there, they are of acute inflammatory origin. So subjective symptoms are much more. The structural changes are very less with psoric. And that's why in heart conditions, we get many features. These conditions are aggravated by eating and drinking. There are palpitations and eructations of large amount of gas. Sometimes the pulsations of the heart will shake the whole body, which is the remedy. Heart pulsations shakes the whole body. Any remedy? Remedy is natrum muriaticum. It is very typical, natrum mur. The psoric patient is always conscious of his heart condition, and it is he who is constantly taking his own pulse. This is again one thing which you can get with the psoric person. They somehow they learn to take the pulse, and they always look toward the pulse and measures the pulse. And they talks, doctor, I have taken just a lunch and pulse is increased. I have checked my pulse in the morning. It was so and so. They talks in that sense. They are very anxious about the heart condition and they feel that they will going to die. But actually, there is no structural damage. All the manifestations of the Psora at the heart level, they are completely typical functional manifestations. So, these are the features of the heart. Tomorrow we'll finish this chapter. So, we'll meet tomorrow and we'll continue with the same chapter and we'll finish the psoric manifestations at anatomical level. So that's all for today. Today evening, there will be no lecture of Materia Medica. We'll meet tomorrow directly at the same time at 6 o'clock. Thank you being there and good night.
Thank you very much, sir.
Thank you, sir. Have a good day.
Thank you, sir.